When you are having chlamydia infection, you can transmit this infection to your baby as a woman who is pregnant. When you are delivering your baby, you can transmit this infection to your baby. So you notice you giving birth to a baby that have eye problem, the baby will be discharging fluid from his or her eye, all in the name of the infection you had when you were pregnant and you didn't treat it. Now, this infection can be in your body and you not even notice it in your body at all, most especially women. So you have this infection for a long time, for 1 year, 2 years, and it won't even show it in your body. You will not have any abnormal discharge. You will not have itchy sensation around your vulva. All this is caused by this particular infection. So it's always advisable you have yourself checked before you get pregnant or while you are pregnant, so you can treat it before you deliver your baby. Because when you don't treat it at early stage and you finally transmit this infection to your baby, you notice your baby having fluid in the eye, redness of the eye, swelling of the eye, and so many issues. The baby will have photophobia. The baby will not be able to look at light very well because you've transmitted this infection to your baby. So you keep on treating the baby's eye and this infection will not go because baby's immunity is very, very low. In as much as it doesn't show sign in your body, doesn't mean you cannot transmit it to your husband, doesn't mean you cannot transmit it to your baby. Yes, you can transmit it to him or her because this infection is highly contagious. It is sexually transmitted and you can also transmit it to your baby while delivering your baby. So if you wish to know more about this particular infection, do well to visit my YouTube channel. I've been able to set up a comprehensive video there on how to manage this infection, how to prevent it, and the medications you can use for this infection in case you're having it in your body. And don't forget that this infection affects both men and women. So as a woman, if you see your man having discharge from his pee, you can advise yourself to go to the hospital and have yourself checked. As a woman, don't think maybe you're not having signs and symptoms and you feel you are okay. No, you might not be okay because women does not have signs of this infection most at times. They might not have discharge, they might not have pains while urinating, but the infection is there. And in case you don't know, this infection is one of the major reasons why a lot of women are undergoing PID. A lot of women have PID as a result of this chlamydia infection because this bacteria is one of the major reasons why people's uterus will get swelling, why your fallopian tube will get swollen. You have infertility, you'll not be able to get pregnant. You might experience pains while menstruating. All this is caused by this infection. You can see the infection causes a lot of things in the body, and that's why I make this video so you can be aware of this particular infection. And again, there are ways in which you can prevent this infection because most at times this infection gets into people's body through unprotected sex. So if you're a kind of person that likes raw with somebody who is infected, you can get this infection. And there are simple ways in which you can prevent this infection by simply taking some kind of medications. And I'll be able to explain that in my YouTube channel. So you can go there, know the kind of medication you can take to prevent yourself from this particular infection. And in case you're having this infection, so you will check yourself to know if you're having it. There are signs and symptoms that shows you're having this infection. Sometimes it shows signs, but sometimes it doesn't show. So it's always advisable you have yourself checked in the hospital, go for lab tests while you are pregnant or as a woman who is wanting to get pregnant. Or even if you are pregnant, you can still check yourself to know if you are having this infection. Because the only way you can check it if it's not showing sign in your body is through lab test. So you need to have yourself checked in the lab. And in case you are not having it as a woman, you can also take prophylaxis antibacterial medication. You can take some medications to prevent it from coming because this infection can come anytime. And sometimes they might even carry out tests on you and they'll notice it's not there. When you don't carry out tests in a good lab, they cannot notice this infection is there while it's still in your body. So do well to have yourself checked. Don't say maybe you don't have signs and symptoms, you're not having discharge, you're not having pains while urinating, you're not having other symptoms, you're not having pains while seeing your menses, and you think you are okay. You're not okay. Sometimes you might have it and it will not show, as I've rightly said. Not just you as a person, advise your husband to go for check as well because when you treat yourself alone and you still meet your partner, you can still get it from your partner. And automatically, if you're having this infection, that means your partner have it as well. So do well to treat the both of you while you are pregnant or before you get pregnant so you not have this infection and you not transmit it to your baby, as I've rightly said. Thank you for watching this video. And I said if you wish to know more about this particular topic, do well to visit my YouTube channel so you can get more amazing videos like this. I will see you next time.